Today,
Okay, shalom.
I go ahead, Oslin.
Yeah, shalom. This is Oslin from the UK, Sister Oslin. And today, our presenter, um, its name, okay, yeah, sorry, I've got that wrong. Our presenter for the physical, emotional class today is Dr. Santy Kit Ling Lee. She has a PhD in clinical psychology at the California University. Um, her pastoral study was on brain health and behavior. Yeah, brain health and behavior. She is an American clinical, um, hold on, sorry. Bear with me, everyone, for a minute. She's a clinical, okay, marriage and family consultant, therapist. She received certification from a college of nutrition in Toronto. Uh, Sorry. Right. You can find her teachings, numbers 11 to 55, at her YouTube channel called Messianic Healing. And the other teachings, 1 to 10, at House of Israel, UK. Today's talk, 54, is on depression and depression and relates to disorders. I got that wrong. Sorry, my loves. Sorry. Depression and yeah. Okay. Today's talk is about depression and related disorders. Okay. Physical view. Okay. So we're going to have a physical view at these disorders today. Okay. Let us welcome now Dr. Santy Kit Ling Lee.
Thank you, Oslin, for introducing me. Oslin is from England, and I was talking to the law from USA. At my background, I want to tell you that I am at San Jose, the capital of Costa Rica, and I'm so delighted to have live audience. My supervisor, Maria, and also her mom, Anna.
Pura vida.
Yeah. So I'm so happy to have them, and wonderful. I'm waiting for Linda from Canada join in, and also the law from USA, and Joe from Canada too. Joanna in Trinidad, she will later on join in. Okay. Today's talk 54 on the topic is bipolar depressions, bipolar disorders and related disorders. Last time I gave a talk on 53 on depressive disorder, and this time I give a talk on bipolar disorder and related disorder from physical will. As you know, that my after my PhD in clinical psychology at a California university, and I further go to continue my postdoctoral study on brain health and behavior. Okay, today I want you to understand bipolar disorder. Bipolar disorder and related disorder are classified separately from depressive disorder and schizophrenia in Diagnostic and Statistical Manual of Mental Disorder, 5th edition, DSM-5. The edition was on 2013. The diagnosis of bipolar depression and related disorder list is in the following. Bipolar 1 disorder characterized by at least one manic episode lasting a week, at least 1 week, possibly followed by a hypomanic, means low, or major depressive episode. That means very depressed, very low, very down. The second one is manic episode. Symptoms include an elevated or irritable mood, goal-directed activities, increased energy, loss of energy, grandiosity, I am the king of the whole universe, hallucination. Oh, next to me is a Queen Elizabeth sitting next to me, and she's killing me. Please save me. Delusion. Look, those are similar characteristics to schizophrenia, right? Well, as I mentioned, special relationship with famous figures in the world. Or this person think that I'm the Pope. Today I'm the Pope. Or I sit next to the Pope, Catholic Pope. Okay, this is what he's thinking. Decreased need for sleep. This person may only sleep for 3 hours or 2 hours and very energetic. Talkative, cannot stop talking. Racing thoughts. Wow, his thought keep going round and round. Distractibility and poor judgment. Because of that, this person can be deceived easily and to make a major or silly financial or legal decision. Reckless behaviors, market, social, or career impairment, and even suicide risk. So it's pretty drastic change in his life. Another type is hypomanic episode. It lasts at least 4 days with similar but less severe symptoms comparing to the last previous two types. As I mentioned earlier, and here it said, schizophrenia can sometimes resemble manic depression, leading to a diagnosis of schizoid affective disorder. So you can see for the psychiatrist, give him a hard time to differentiate if he is not specialized on this area. And the next type, a major depressive episode. The features include depressed mood, loss of interest, lack of motivation, and avoidance. I'm talking about episode. So it's a short period of time. And however, if you pay attention to my last talk, 53, then you can see the depression lasts for at least a year. Okay, this is only an episode. Bipolar 2 disorder requires at least one major depressive episode and one hypomanic episode, causing significant work or social issues. Okay, so if you find that person at work or in social relationship experiencing at least one major depressive episode and one hypomanic episode, you have to pay attention. Is this person bipolar 2? That's why I separate two talks. The next one, cyclothymic disorder. It lasts for 2 years for adults, but 1 year in children. It features the numerous hypomanic and depressive symptoms. Hypomanic, we know that very high, think high, I'm the king of the US, something like that. And also depressed later on. But don't meet full criteria for mania, hypomania, or major depression, schizophrenia, or schizoaffective disorder. So the disorder have to be 2 years and not fully meet the criteria of what I just taught. Next one, substance or medication induced bipolar disorder result from substance use or medication effects. So the cause of this disorder would be mainly substance or medication. You can see the damage of medication. Unspecified bipolar disorder diagnosed when symptoms don't fit specific criteria. This is disorder give the psychiatrist or psychologist some opportunity to put down this disorder, because maybe this specialists have a hard time to figure out which type specifically to make decision. The next one is a specifier for bipolar disorder that include anxiety, consideration, condition like I mentioned high histamine, another name is histadelia. The significant feature would be obsessive compulsion and pyroluria. The significant feature would be paranoia and confusion. So if people suffer from these two conditions, they can be misdiagnosed as bipolar disorder, especially manic episode or schizophrenia. Please pay attention to my talk 52 to understand the definition and characteristic of both histadelia and pyroluria. Let's continue. Let's look at the physical causes. Major physical causes of bipolar-related disorder include excessive use of coffee. Oh, drink coffee all the time. High stress level. Hormonal imbalance. Food allergies. Oh, come on. If you take the wrong food that's not matched with your body, that create a loss of allergies. Or malnutrition. Okay, so your body lack the right kind of nutrition. Because nutrients play a major role in stabilize our mood and reducing anxiety, reducing mood swings. Often you look at they all related to stress, like insomnia. When a person lack of sleep, then those symptoms may appear easily. Factors like trigger manic episode include cigarette smoking, like blood sugar imbalance, like high blood pressure, take too much artificial sugar, food allergies, particularly from gluten. Where can we find gluten? From wheat. Okay. Inhalant allergies. And in some area, the tree and grass or wheat pollen show up at a certain month of the year. Then if you inhale those allergy, you feel so uncomfortable, sneezing or very uncomfortable. Low levels of omega-3 fats. Wow, that's significant. I recommend everyone must take omega-3 fat from either a fish or from flaxseed. But you have to figure out what kind of fish, the salmon fish in polluted area or not. Niacin, vitamin B3 and amino acids such as tyrosine and taurine. Sleep deprivation, I just mentioned, can reduce absorption or the body amount of magnesium, zinc, and vitamin C level. So sleep would be very important. Continuously sleep is important. Another factor would be genetic. It plays a major role in manifesting bipolar disorder. Individual with a first-degree relative diagnosed with bipolar disorder end up has 25 to 50% risk. Therefore, we have to pay attention. A 183 study indicate the influence of environmental and learned behavior. I would recommend before this couple start dating or getting married, just as early as possible. If one partner that has been or the parents are genetically trace back the family tree, anyone in the family suffer from bipolar disorder, then I recommend this couple before they start dating even receive genetic counseling for family planning. Let's look at treatment. To manage a bipolar-related disorder, important to decrease the intake of coffee. Sugar, especially man-made sugar, can contribute to depression. Stimulants, stimulant include medication. Cigarette smoking can be harmful during manic episode. And gluten, avoid eating wheat product. You can eat something else like a meat or something else, okay? The following nutrients and management strategies are recommended below. Number one, omega-3 fats include fish or flaxseed intake. I just mentioned earlier. Number two, magnesium. Magnesium is so important to our body. It acts as a mild tranquilizer. If you cannot sleep well, you may take a magnesium before you sleep. Intravenous magnesium sulfate can help you calm your manic episode. Number three, niacin, that is B3, beneficial for managing your manic state. Number four, vitamin C, 1 gram per day. As anxiety and excitement can deplete the vitamin C level quickly. Those doses are advised by Dr. Patrick Halbert. The book on 2003, I just list on this slide. Okay, next one, amino acid. You can use L-tryptophan 1 gram 2 times a day to help prevent mania. However, if the person is in manic state, at the same time taking antidepressant, L-tryptophan is not helpful because we increase the manic phase. Next one, tyrosine, helpful during depressive phase, but high dosage can trigger mania. So what are the dosage intake? Next one, taurine support GABA production. GABA is very important. GABA, you can get a GABA from the health store too. It helps you with to treat the mania, irritability, insomnia, migraines, alcoholism, and obsession. So if your clients has obsessive compulsion, this is a good use GABA. Number 7, herbal. Herbal treatment. I list the following. A, St. John wort. In my previous talk, I comment the comparison between medication and St. John wort. Please go back to my previous talk, 53. St. John wort is useful for managing mania in manic depression. Number 2, kava. It promotes sleep, but should not be used with Valium. Valium and another name is diazepam. Insomnia in manic states can rapidly deplete the level of magnesium, zinc, and vitamin C. That's why I always stress on sleep well, sleep continuously. Okay, I'm running out of time soon. Okay, next one, multivitamin and minerals. Take them daily. Number 9, allergy management. Identify and prevent food and environmental allergies. Next one, self-management. Keep a food diary to address your problem of sleep, nutrition, and mood swing. Warning from lithium. Lithium usually prescribed by a psychiatrist. Use drug. This is a drug and can seen as essential trace mineral. High dosage can suppress emotional expression and lead to aggression rather than restoring emotional health. So you have to be careful before you make an informed decision if you want to take lithium or not. Bipolar disorder, let's look at the conclusion. And related condition can pose significant challenge for psychiatrists in diagnosis and treatment. Understanding the physical causes and applying the right nutrients and herbs can help calm the manic episode, manage stress, improve memory, enhance sleep quality, boost mood and motivation, and address psychomotor retardation. Harvard demonstrate the powerful effects of nutrition comparing to medication for this disorder. And he emphasized the importance of correcting biochemical imbalances alongside psychotherapy. Psychotherapy is so important. However, long-term recovery should also incorporate spiritual nourishment and psychological support because spirit, mind, and body are interrelated. A holistic approach is essential for long-lasting effectiveness and root treatment. I used the following resources to make up today's talk. Of course, DSM-5, Banner's book, Baker, Encyclopedia of Psychology. Again, Patrick Harvard, a very powerful book, Optimal Nutrition for the Mind. And the last one would be Psychiatric Annals by Winlow. look at the genetic aspect of this disorder. I attend House of Israel UK and Tomodae Yashu Fellowship, and Tomodae Yashu Fellowship located in Georgetown, Ontario for Sabbath worship. You're welcome to join the spiritual, physical, and emotional cleansing training. If you do desire, appreciate my talk and want to give an offering to me, you can send by Western Union. If you send it, please send to Panama by December, before December 15th. My first name is Santy, my last name is Lee, Lee, province Cherokee, city David. If you send by PayPal, there's no time limit. My email address is drleesconsultation@protonmail.com. Thank you for your offering. May Yahweh greatly reward you. Now, I have 5 minutes. We can talk and share. Okay. And so, and any question, any comment?
Question.
Yeah.
When you refer to specifiers for bipolar disorders, what does it mean exactly? Because you talked about not confusing high histamine, histadelia, or excessive compulsion with bipolar, and not confusing paranoia and confusion with bipolar. Can you please explain that a little further?
Yes. If you listen my previous talk, so you can find out the differences. Because the characteristic would be so similar. However, if you discover the more characteristic on high histamine and the characteristic of pyroluria, then you won't make a mistake.
Okay, great. So
please go back to my previous talk.
What talk?
My previous talk. Previous. Yeah, go to 52.
Okay, great.
Okay. Oslin, any comment or anything you want to say?
Not really. I'll have to go through it again because
Yes.
they are very similar.
Yes.
So I
Yeah,
will
I
have
can
to go
send
back
you.
to the other one.
Yes. Okay,
Mm.
good. I guess we can let me turn off the recording and we can play for each other.